My name is Jesse. I'm a chiropractor and I practice at Square One Active Recovery. This is a practice I started when I moved back to Singapore for about maybe 4 years ago. And I've been practicing just here for all my entire time in Singapore. Before this, I was in Australia and I mostly worked with athletes, so mostly high-level athletes, and didn't really practice at a specific place. So I moved around between clubs and things like that. For flat foot, maybe depends on what you want to solve. So let's say if you want to make your flat foot unflattened, like you want to unflatten your flat foot, that's a bit more contentious, I suppose. We don't really know how possible it is to make the arch return. There are definitely exercises and treatments where people can try to encourage the arch to return. But in terms of success rate-wise, it's not very well published. But if you're having, say, certain type of foot symptoms, or even generally around the area sort of symptoms like at the soles, your ankles, and you think that it's coming from your flat foot, you usually can address that quite well. The thing that is maybe a bit harder to talk about results-wise is probably whether we can re-arch the flat foot. No. Okay. I used to maybe shadow or observe a veterinarian who does chiropractic work. So he does spinal manipulations, chiro adjustments for dogs and horses. It's quite interesting in the sense that you can see that the behavioral change. So usually people who in Australia, so I was in Australia when that happened, usually people who seek such services are show dogs or show horses. So they have routines that they will need to do. So they're essentially athletes, animal athletes. And we do see that, after going through spinal manipulation or adjustments, depending on how you look at it, the performance change. So the way they behave would change right before they receive it and right after they receive it. So a lot of times, in that context, you would see that before major shows, they will be booked out with patients, so all the dogs will come in, or the horses will come in before major shows. But we're not really sure if that has true long-term sort of outcomes. So that is kind of how I guess people are using chiro adjustments in overseas. If it comes to maybe say some sort of condition with your dog maybe having problems with walking and stuff like that, we're not really sure how long lasting the effect will be. So maybe you go for it now, this afternoon, later in the evening, you might see that your dog gait pattern may change, may improve, but we don't really know how long that improvement. Actually, the improvement is usually quite short, maybe a few days, a few weeks. But we don't know that if we keep going for it over and over again, would it ever fully resolve the initial problem? Yeah, so that's I guess undecided for now. If the problem is musculoskeletal problem, then yes, quite common we see that. So when I was in Australia, chiropractors, chiropractors in Australia, they're still considered first-line providers. So you don't need a referral to see a chiropractor in Australia. You also don't need a referral to work with a chiropractor in the United States as well. So yeah, so if you have something like back pain, neck pain, you can see a chiropractor without needing a referral. Quite often we find that when it comes to musculoskeletal care, general practitioners probably aren't the best at it because they have more pressing issues to manage, and that's quite a small set of their practice. So usually for those cases, chiropractors tend to manage them better. So usually we have a checklist before we allow them to make an appointment. So we go through an onboarding form situation where they fill in a 4-page form, and we'll go through the case to see if there's anything that sticks out that would suggest that they would not be responsive to our care. There are people who will slip through the gaps, and then they will come, and then based on how they present, we will advise them accordingly. It's not possible to diagnose or know someone has, say, rheumatoid arthritis without some sort of additional testing, blood testing whatsoever. So usually at the first session, it's not possible to tell as well. So at that point in time, we usually give our clients the option, do you still want to continue and see what happens? Or maybe at this point in time, you want to go, see a GP, get a blood test, know your diagnosis before you come back to us. Most of the time, people will just keep going because for them to come to us in the first place, they usually usually have already pre-decided that they would like to avoid medication or any sort of medical intervention for as long as they can. So they usually would just say, give it a shot first, and if it doesn't work, then fine, we'll go back to our medication or surgery and things like that. So again, this only applies to like musculoskeletal care. So if it's like hypertension and things like that, then it's a different story altogether. It's not many conditions musculoskeletal where exercise cannot help with. So let's say if you look at knee pain, right? Say someone tore their ACL ligaments or one of the ligaments in your knee. We look at surgical outcomes and conservative outcomes over a 20-year period. They're comparable. So in that sense, you can choose to go for surgery and you can choose to go for like a more conservative exercise-based treatment, and the outcomes are comparable. There's very rare chances of musculoskeletal conditions today where conservative type exercise-based treatment would be inferior to more aggressive treatments, if you want to put it that way. Yeah.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.